Hi, I'm Eric Johnson here at the Owen Graduate School of Management, and I'm here today with Joe Mello. Joe is the COO of DaVita Healthcare Partners. And well, of course, Nashville is just a huge healthcare city, and a lot of our students like thinking about healthcare and healthcare business. So it's really great to have you here today, Joe.
Thanks, it's great to be here, Eric.
Well, you've had an amazing career in healthcare management, stemming back to the 80s, both on the consulting side and the operating side. What's changed? How has it evolved?
It's been amazing. It's been an amazing journey to see what's happened with healthcare. And I think one of the more fundamental things that's happened is that healthcare has really started to act more like most businesses act. They want professional management in place. They need, and we need, more fact-based management and fact-based orientation to decision making. There needs to be much more done with strategy. And so that's really forced healthcare executives to evolve their toolkit for how they approach things.
Well, certainly that bodes well for our MBA students who are interested in being in that space, and I know that you'll get to meet some of them today that are very excited about going there. What kind of advice do you give young professionals who are looking to enter the healthcare management space?
Yeah, I think there's three things that really come to mind when it comes to getting young folks to really understand how to engage in healthcare. The first is that it's a real people business. And so while you can learn a lot about how to do discounted cash flow and a lot of things in a business school, so much of what happens in life, and particularly in healthcare, comes down to that interaction between individuals. And so social skills end up being a really important part of what we look for when we're bringing new folks into our DaVita village. Second thing is analytics and just being sound and fact-based in how people make decisions and getting that skill set really well developed and really well honed. And the third is really consider general management. There is just a lacking of strong general management skills in scale healthcare organizations. And so if you have any sense that you want to move into general management focus, it's a great place to be.
That's great. Well, certainly, as I said, a lot of our students are thinking about those kinds of directions. So, well, you know, I saw in Fast Company you were quoted as saying that organizations need mavericks, that they challenge assumptions, that it's good to have some mavericks in the organization. But I guess I'm curious, why should leaders foster and protect mavericks?
Yeah, I think what we have found, and what I certainly have experienced, is that when you surround yourself around folks who are intellectually aggressive, it forces you to think differently and better. And my experience with really good leaders is that they're way open to getting divergent opinions and trying to act on them. And doing more than just listening to them and then doing what they want to do, but really listening to them and trying to understand their point of view. And so we really do try to seek out people who will stir the pot a little bit, because I think that makes for better decisions for the organization, as long as we as leaders are willing to listen to them and to really try to process what they're thinking.
Well, Joe, thanks so much for spending the day with us at Vanderbilt.
It's going to be a great day. I'm looking forward to it.